It might surprise you to learn just how common the publication of erroneous statistical analyses is. A recent study examined 281 articles published in leading psychology journals. Astonishingly, at least one statistical error was found in half of these articles, with 15% containing errors that could potentially reverse the study's conclusions, usually to the opposite of what the researchers intended. These findings only represent the tip of the iceberg, considering they only cover published research. What happens in the earlier stages of research, often behind closed doors, remains largely unknown to the public. A 2009 survey among 2,000 American psychologists revealed that 70% admitted to cutting corners when publishing papers. A third of respondents confessed to reporting unexpected results as if they were hypothesized from the start, and 1% directly admitted to fabricating data. A groundbreaking survey published by Nature magazine on June 14, 2005, found that 1 in 3 researchers had engaged in questionable practices during medical experiments. This survey, involving 3,250 American researchers who received biomedical research funding from the National Institutes of Health, marks the first quantitative investigation into research misconduct. About a third of those surveyed admitted to violating one of the accepted research norms in the past 3 years. This includes practices such as omitting data based on a gut feeling that it might be incorrect. In the realm of medical research, often funded by pharmaceutical companies, the survey's findings are particularly troubling. Research funded by these companies is more likely to yield positive results for their drugs, influencing medical policy and treatment choices. The implications of these practices extend beyond academia. In Israel, for instance, cases of research forgery have led to significant public outcry and scrutiny over the oversight of human trials. This widespread issue of unethical behavior in research raises significant concerns. Brian Martinson and his colleagues from Health Partners Research Foundation in Minnesota stress that such normal misbehavior poses a greater threat to scientific integrity than the widely publicized cases of fraud. Cut to Expert 3 speaking. Expert 3. The modern scientist faces intense competition and sometimes unreasonable societal and regulatory demands, which can lead to compromises on scientific integrity. Cut to Host. The academic world is not immune to these pressures. Cases of researchers signing off on papers they didn't contribute to in order to bolster their CVs are unfortunately common and reflect deeper systemic issues within academia. Visual transition. Animated sequence illustrating the pressure on researchers. From the story of a researcher fired for refusing to include non-contributors on a paper to nurses and doctors bending or breaking rules for perceived benefits, the ethical landscape of the research is fraught with challenges. As we've seen today, the journey towards knowledge is complex and sometimes compromised by human flaws. Our trust in the research process must be tempered with vigilance and a commitment to integrity. This concludes our exploration in episode 9 of Faith in the Age of Knowledge. Join us next time as we continue to uncover the truths behind our history and the science that shapes our understanding of the world.